Good morning, good afternoon, everybody, whichever part of the world you are. My name is Hugh Maxwell. As Susan introduced me, I've been a fellow of the RSM since 2007, and where we're picking up today is really revisiting what lessons we've learned in COVID-19 time. We had a number of seminars which were shared through the IRSM involving Helen, involving Caroline, and today we're very honoured to welcome an esteemed speaker from the ILO, Halske Grachik, who is a technical specialist in occupational safety and health, who will be sharing an insight into the findings and really the vision that the ILO have developed as a basis of what's been happening with COVID. So I'll introduce you first to Helen Barge. Helen Barge is the Managing Director of Risk Evolves and esteemed contributor to some of the IRSM work in terms of COVID recovery, as is Caroline Sapriel, who is the Managing Partner of CSNA International. So without further ado, we'll start this session with a presentation from Halske, followed by which I'll be sharing a number of questions regarding the lessons we've learned over COVID with our esteemed panel. So I'd like to hand over now to Halske to share her presentation. Please put your questions through on the side and we'll have a question and answer session at the end. Thank you so much, everybody. I hope you enjoy it.
Okay. Thank you so much for that introduction. It's a pleasure to be here. First, I'll ask if you can see my screen.
Yes.
We can. Yes, you can. Very good. Very good. Oh, I just lost it. Let's see where it is. Okay. Oh, I've lost my presentation. So, oh, there it is. Okay. Hopefully you can see it now. So thank you again for that introduction. It's a pleasure to be here with you today. I'm Halske Grachik, and I'm coming to you from Geneva, from the International Labour Organization, to talk to you about what we've learned in the last 2 years now, almost, when it comes to the world of work and managing COVID-19 from an occupational safety and health perspective, and specifically from a psychosocial risk perspective. So first, I'd like to give a brief introduction to the ILO. For those of you that are not familiar with it, we're one of the oldest United Nations agencies, founded more than 100 years ago, really with a mission to specifically look at world of work issues, rights at work, decent employment opportunities, ensuring social protection for all workers, especially the most vulnerable ones, and making sure that there's sound social dialogue in place. Now, we're a unique agency in that we work with 3 unique tripartite constituents. These are governments, mostly ministries of labor, employers organizations and industry organizations, as well as workers, their unions, and their organizations at the local and also at the national level, as well as the international level, of course. And in all of those stakeholders, we work with 187 member states. On broad areas of work, one of those being occupational safety and health. So today my presentation will really be highlighting the point that safe and healthy working conditions are absolutely fundamental to decent work. It's important that we have safe and healthy conditions to keep us all in good health and in good well-being, but also to ensure that we have productivity, to make sure that our economies are resilient, to make sure that we can continue to provide jobs for all workers that are seeking employment. Now, to start on the importance of occupational safety and health in general, we recently conducted joint estimates with the World Health Organization, and we found that overall, we can say that there's almost 2 million people that lose their life every year just because of diseases and injuries that are directly linked to workplace exposures. Now, we know that this must be an underestimate because we can only use the data that we have, and in many regions of the world, it's difficult to have precise data. Now, what's interesting to highlight here is that we usually think of occupational injuries, things like slips, trips, falls, explosions, fires being the main cause of death, but actually more than 80% of deaths are linked to occupational diseases. So this is a shifting trend in the world of work. And we see that when we look at those diseases, a lot of those are chronic conditions, things like chronic obstructive pulmonary disease, COPD, stroke, or heart diseases or other heart conditions. And when we look at the risk factors that put workers at the most risk, it's very interesting that we have a wide array of exposures. Of course, that happened because there's so many different economic sectors. But one new finding this year that was certainly provoking for all of us working in this sector is that for the first time we were able to calculate the impact of long working hours and what that does to a worker's health. And we found that long working hours, certainly something that impacts many parts of the world, can be linked to 750,000 deaths a year. So we see that this is something new, it's a shifting trends, and even though we're moving to those new concepts of psychosocial risks and risks from things like extensive working periods, we also have to keep in mind that there's other classic risks that still take place, things like air pollution, gases and fumes, and injuries. Now, despite this diverse risk potential, one thing, and something I'll be talking about today mostly, one phenomenon that linked all of us, all workers in the world of work, no matter where we were, no matter what sector we were working in, was the COVID-19 pandemic. One of the first big messages, quotes that came out from our Director General at the International Labour Organization, Mr. Guy Ryder, was that it was clear that unsafe workplaces anywhere can be threats to the safety and health of workers and all populations everywhere. Now, we saw this very acutely because the first epicenters of the pandemic were in workplaces that had high density, places like markets, slaughterhouses, and food production facilities. Of course, healthcare facilities and nursing homes, as well as prisons. And we saw that while all workers were impacted, the essential workers had the most severe psychosocial impacts. We'll get more into this, of course, in the future slides. But we also had a moment of a global reckoning where we realized that there always was talk of occupational hygiene, occupational safety and health. It's important, yes. But for the first time, I believe that COVID-19 highlighted the point that workplaces are essential to ensuring that we have safe and healthy populations worldwide. So we saw a shift, we saw a focus to managing the contagion, but also managing working environments and ensuring that we weren't just safe and healthy, but we also had some level of well-being during these last few years. And something we'll talk about as well is the importance of making sure that we continue to implement the frameworks that we're so familiar with, things like risk assessment and risk management, but making sure that we have an integrated approach due to new emerging hazards, things like the pandemic. So what did we see with the COVID-19 pandemic? Well, certainly the very first point was a new biological hazard, risk of contagion. This was at the very first days of the pandemic. This was the most important consideration, making sure that we have protocols in place to protect workers from the biological hazard. However, we quickly realized that there were so many other risks that were now coming into the workplace, things like chemical hazards from all the new disinfectants that were suddenly being produced and moved around the world and used in workplaces, used in homes. Even 2 years later, I this week received a question from one of our field offices in Zambia, who was very concerned about a chemical that was being used as a disinfectant that actually looked as if it was extremely hazardous to health and was not being applied in the proper manner. And it was not even clear if it was effective against COVID. So these kind of chemical hazards are still something that we have to take into consideration. They lead to respiratory conditions, that some can have impacts on reproductive health. So we quickly saw that we have also a big risk due to chemical hazards that we hadn't seen before. Something as well to take into consideration is the physical environment and new ergonomic hazards. To give a personal case study, at the ILO, our OSH team was very quickly asked to respond to numerous requests from field offices and constituents all around the world to write new guidelines, to write recommendations, to give updates on the situation. And we had several people suffer from carpal tunnel-like effects due to working in new workspaces on their laptops for multiple hours a day in their bedrooms, in their children's rooms, at their dining room tables. So we saw also the risk of ergonomic hazards for many workers who suddenly had to change completely their work processes. Now, then we get into another category of psychosocial related risks due to new workloads, new work paces, new challenges when it comes to work-life balance, and also the potential for things like violence and harassment in a new workspace. And so these are things that we'll talk about today. Now, what did we see in regards to the impact of psychosocial risks and work-related stress during the pandemic? Well, certainly the first thing that we monitored and that we took account for in all of our regions of the world were the psychosocial responses. We saw high levels of exhaustion, anxiety, a rise in burnout, a lack of motivation. This was for many workers across all sectors, but it was certainly in the workers that had the highest stress situations, whether those were the frontline workers or they were the workers that were not frontline, but were suddenly dealing with huge amounts of pressures due to the balance of work and also dealing with life during lockdowns. We saw related to psychosocial risk also physical reactions, unexplained aches and pains, cardiovascular illnesses, digestive problems linked to those psychosocial issues caused by the pandemic. Now, something that was interesting to note as well is an increased risk of work injuries and accidents in certain workplaces that stayed open due to psychosocial impacts, reduced accuracy, exhaustion, burnout. These were things that were real considerations for many workplaces. And certainly due to all these impacts, a reduction of workplace productivity. Not only absenteeism, but a high degree of presenteeism. When you are present on the job, but have reduced job performance in respect both to the quality, but also the quantity of work due to the pressures. One risk factor I want to highlight, because it's something that the WHO and ILO has been working on closely, has been the impact of teleworking during the pandemic. So telework was suddenly a new unescapable reality for many workers around the world, shifting from one day to the other. And we saw that in Europe, for example, the proportion of workers that were teleworking increased from around 10% before the pandemic to almost 50%. And this has continued to remain the trend in many sectors, despite changes in regulations for the pandemic. But it's something that has stayed on, and it's something that employers will be needing to deal with when it comes to ensuring that there are appropriate settings for workers. So what was done by WHO and ILO was a rapid review of the literature to ensure that we understood what is the evidence base on telework and the impact of workers. So it was very interesting because it was a dual result. We saw that there are positive impacts of health for certain workers. We saw that there can be a reduction in work-related stress and other work-related psychosocial impacts such as anxiety and depression, but also reduced blood pressure in some cases. There was also a lower risk for certain abuses such as alcohol abuse or tobacco consumption, as well as obesity, due to new changes in frameworks for well-being and some workers able to fully appreciate increased time in the case that they didn't have too many work-life issues, and that they could properly ensure that they were taking care of their well-being, maybe by reducing their commuting time, etc. But we also saw some harmful impacts of health. So evidence from the literature showed that telework can also be associated with different types of ergonomic hazards, things like muscle and joint pain, eye strain. There was a number of results that showed that specifically eye health can suffer during teleworking periods, but also in other workers in different sectors, we saw the opposite effect for psychosocial impacts. We did see that they can also lead to stress, anxiety, and loneliness. So it truly depends on the setting. And the big takeaway from this literature review was that teleworking conditions will really impact workers in different ways based on how we plan, how we prepare for telework, and how we promote social dialogue to ensure that workers and employers are communicating to ensure that we could properly create these frameworks for health and well-being during telework. So the new publication that came out recently, just about a week ago, 2 weeks ago, highlighted these results and also imparted the message that protecting and promoting health and well-being for all workers will require not only that social dialogue that I mentioned, but also a comprehensive set of measures. So it will take different levels of prevention to make sure that we're keeping workers safe and healthy in their workspace that are so unique and are so multifaceted and that really require an individualistic approach. So I want to talk about a definition because it's something that was important that came out actually before the pandemic, but the importance of properly labeling some of the psychosocial impacts that we might face. So just before the pandemic, burnout was classified as an occupational phenomenon in the International Classification of Diseases, supported by WHO and ILO. And it's interesting here that we have a very specific definition for what burnout means. And here you have those definitions. But I'd like to highlight here that it really refers to a phenomenon in the occupational context and should not be applied to other experiences in life. And this is very important because it keeps a framework for the world of work and allows for a response that can be employer-specific, worker-specific, workplace-specific. The importance of having proper definitions is that then we can create frameworks that allow for these responses. We can also allow for appropriate compensation mechanisms, of course, if there are clear links to work-related diseases or work-related phenomena. So now, how do we respond to this changing world of work and COVID-19 induced psychosocial impacts? Well, these are the 10 areas of action that the ILO, after this time responding to the pandemic, responding to different constituent needs in different regions and different countries. These are the 10 areas of action that the ILO found to be the most important when it comes to managing psychosocial risks. Now, I want to highlight that we, of course, work in the EU region, but we're also supporting constituents in all countries of the world. And therefore, we have to take into consideration the various types of risks that could come up in different sectors and in different realities. So the first action area is the importance of having appropriate environment and equipment. And I mentioned a little bit about ergonomic risks, physical risks, the importance of having the proper equipment in place, and not only to care for those musculoskeletal disorders, but also to have the proper safety equipment, things like personal protective equipment, managing prolonged use of very heavy personal protective equipment, and sometimes addressing those important barriers that come of not having enough PPE or not having the proper PPE to the people, the workers that need it. And so our suggested action here was using our established frameworks. So using risk assessment, risk management, the basic fundamental steps of occupational hygiene. For example, the very first step of hazard identification. We realized that we need to just adapt what we have already, not start from scratch, but use our methodologies for hazard identification to ensure that we're properly taking into account COVID-19 risks. So the first stage is looking at hazardous agents. So not only the coronavirus itself at the very beginning of the pandemic, but also things like chemical agents. What are other hazardous agents in this workplace? Could they be situations that are promoting violence and harassment? Are they situations promoting ergonomic challenges, etc.? So it's that identification of hazardous agents that's fundamental. Now, secondly, the groups of workers is also important because different types of workers will face different types of health effects. If we're talking about women of childbearing age or pregnant women or women who are breastfeeding, they have very different risks, potential health outcomes than other populations. We also have to be concerned of different age of workers. Older workers in this situation were particularly at risk. Or, for example, migrant workers that might be facing language challenges or lack of access to social protection services. Now, after that hazard identification step, we moved to the assessment of risk. So we tried to understand what is the risk that is being posed and what is the best way to eliminate that potential risk to the greatest extent possible. That follows our classic risk assessment frameworks. Many countries, many workplaces have their own in place that follow similar guidelines. And the importance here is to apply those risk assessment frameworks and not try to create them from scratch just because we have a new hazardous agent in place. Now, the last step, of course, is the control of risk, making sure that we're following the hierarchy of controls and looking at what are the most effective ways to either minimize the risk to substitute that hazardous process, or if we can fully eliminate it, that would be the best situation. So here's how can we adapt to this new world of work challenge. And here it's what I mentioned before, is making sure that we can take into account all of the new situations that are arising, but following those classic approaches that we have. So here, for example, our hierarchy of controls, which many of you must be familiar with. But during the pandemic, we saw that there are proper ways to implement this and make sure that we're following this classic procedure for all workplaces around the world, because it can be applied to all sectors and all situations around the world, no matter what the resource level is. So we saw the top two levels, elimination and substitution. It's very difficult in this situation. Before we had things like vaccines that could properly eliminate or reduce the risk. But in the first stages of the pandemic, we saw that elimination and substitution could be implemented by telework or by changing workplaces. So eliminating that potential risk of exposure by removing workers from those concentrated work areas, for example. Then we moved down to engineering controls for essential workers, or in situations where workers had to be in the workplace. We implemented things like engineering controls, so things like physical barriers, plastic screens, making sure that we have proper ventilation in place to improve circulation of air coming into the workplace. Then moving down into administrative controls, these are things like making sure that there was a proper health and hygiene practice in place, hand washing, areas for hand washing, time for hand washing. This also includes very important policies, such as making sure there's paid sick leave for workers. So workers do not show up to work when they are potentially sick and able to spread the virus. And then the last step, which was very important during the pandemic, but it still is the very last step because it's considered the least effective, and that's things like PPE, making sure that there were proper masks used that were matching not only the work tasks, so if there were exposure to fumes or gases, but also making sure that there was a proper protection against the virus. So this is the last stage because it's really the last step that we can stop transmission. But of course, during the pandemic was a very important one, and we saw that there were many gaps in regards to access to PPE in certain places. Now, the second area that we looked at was the importance of a proper workload, work pace, and work schedule. We saw that workers that were emergency response workers or workers in the production of essential goods had extreme pressures due to overwork, overtime, heavy workloads. These put an immense amount of stress and negative psychosocial health effects on their well-being, but also on their productivity and on their job satisfaction. So we developed a number of actions that were implemented at different levels. And here are just some examples of things that we could do. But this is really where an employer needed to take stock of what was happening, of what the working methods were, of what the tasks were, and acknowledging that this is a moment of great difficulty and trying to understand how you could best combine the realities of the situation, but also trying to ensure workers' well-being, because at the end of the day, it wasn't about just their safety and health, but it was also about their ability to keep coming to work and performing their function. So it was the first time really that there was a global understanding of the need to properly manage work pace and work schedules in order to ensure that we could retain some of those essential workers that were on the front lines. Something important also that came up was violence and harassment. We saw that many workers, whether these were healthcare workers, that were facing harassment, or that were facing violence, or were facing stigmatization, but also due to the change in due to the change in working conditions for many at-home workers, this sudden shift to virtual work and what that might mean for things like cyberbullying, or even for domestic violence, where the lines between the workspace and the home space were blurred. And there was very little room for any kind of change in those working conditions due to long periods of lockdown. And this is where the ILO was particularly useful for many countries, especially at the national level, because also just before the pandemic, the ILO created a new international labor standard, ILO Convention number 190. I hope that some of you are familiar with it. But it's a brand new convention, the very first international labor standard created for the world of work to specifically address violence and harassment. And so this was something that was taken up by many national governments, and quickly we realized the importance of implementing measures for violence and harassment during the COVID pandemic. So when we speak about violence and harassment, it's not just one type of violence or one type of harassment. This can be many different situations. This could be verbal and psychological abuse. This could be stuff like mobbing, which is very important in certain settings. Moral harassment, interpersonal mistreatment, sexual harassment, bullying. So there are many different types of potential violence and harassment risks in the world of work, and it's important that we understand its breadth and its potential vastness in regards to what could take place in the workplace. So suggested actions, the very first suggested action was working with national governments to make sure that at the national level there are approaches to dealing with violence and harassment, that countries integrate into their policies of what can be done when there's violence and harassment in the world of work, guided by this new Convention 190. Now, whatever happens at the national level, our efforts also were to ensure that those policies can trickle down to workplace policies, to make sure that workplaces, that enterprises, that employers implement violence and harassment policies, and not only implement them, but make sure that all staff are aware of them and are trained in what they mean. And that's very important, because we can't just stop at developing those policies, but there's always the second step of training workers, of making sure that individuals are aware and are responsible for their own behaviors at the workplace. And this is just like creating a policy on asbestos control. Workplaces have the responsibility to keep their workers safe and healthy, and therefore need to implement policies against things like exposure to asbestos. Well, in the ILO's view, the exposure to violence and harassment is also a grave threat to safety, health, and well-being, and therefore the workplace should also promote measures to have policies against exposures to these types of psychosocial risks as well. So these were very important measures during the pandemic that started at the national level, but then trickled down to the workplace level. So number 4 was the importance of work-life balance. We saw very quickly, especially for families, especially for female workers that were dealing with traditional roles of making sure that they have to take care of household responsibilities and caregiving duties, but also balancing that with their professional activities. This was something that was seen especially as a difficult challenge for female workers during the pandemic. And in this case, the ILO worked with different partners, but especially UNICEF, to develop guides for government level policies that could also go to enterprise levels, to make sure that there are changes in flexibility for working time arrangements, making sure that there are paid sick leave policies, but also changes in administration, so making sure that things like annual leave and parental leave could be used and substituted as needed. There's also a shift on employers on the focus moving from just quantity to quality. and ensuring that there was that proper understanding and active social dialogue going on when it comes to the real responsibilities and the real realities, especially during times of the strictest lockdown. We saw that when it came to psychosocial risk, something like job security was particularly important and was particularly leading to many psychosocial impacts. There were a number of different groups of workers that were at increased risk. When we talk about the changing world of work, we're moving to systems of more informal economies, gig economies, online systems, and we saw that there were many types of workers that were at increased risk due to job security because of a lack of contractual arrangements, but also because of a lack of social protection mechanisms. And here there were different types of policy actions that were suggested, guidelines for protecting workers from unfair dismissals, making sure that there were new plans that were working in dialogue with government partners, but also with enterprise leaders to see how there could be proper systems in place for caring for workers, and also businesses that were dealing with sudden shifts in production cycles. We also saw something interesting that came out was the importance of having adequate and effective management leadership. Many workers were looking to leaders in this very difficult time and making sure that employers and managers had the proper training, had the proper commitment as well to guiding their workers in these very difficult periods. So something that was seen and that the ILO provided some recommendations and guidelines on was making sure that there was reliable information that was presented from national and local authorities regarding the pandemic, but also regarding its impacts, also the psychosocial impacts. And something that was clear as well was making sure that there were business plans and OSH protocols in place and that they were implemented in proper ways, but also that managers and that leaders were role models for staff, taking things like occupational safety and health measures seriously, including things like making sure that workers were properly supported and had the proper support mechanisms in place when they needed based on their unique situations. We found that communication, information, and training was very important. As mentioned before, it wasn't just about implementing those policies, implementing risk assessments, but also making sure that workers were trained in what that information meant, trained in how to conduct a participative walk-through risk assessment and think places like factories, and also understanding how to properly implement measures that resulted from those risk assessments. So here, the importance of specific messaging was very important, but also caring for workers that had specific vulnerabilities. So some research that came out during the pandemic was that certain groups of workers were more likely to actually be infected with COVID-19, but then also suffer from resulting health effects like psychosocial impacts. And a lot of these were migrant workers in the EU space. And that was due to things like language barriers, but also being on the front line due to having some of those essential worker jobs and not having many other options and having to show up for work despite hazardous conditions. Another important area is health promotion. So this is very interesting because we also moved away from looking at classic occupational hygiene, classic occupational safety and health only, but also moving to what does well-being mean in the world of work? Are there changes in healthy lifestyles because of teleworking, because of changes in workloads, because of work-life balance and dealing with family stresses? So how can employers shift from only looking at health and safety, but also trying to promote well-being? Things like making sure we have proper eating habits, reduced alcohol and cigarettes consumption, physical exercise, sleep patterns, all of these things that suddenly became part of the world of work as these lines blurred between work and life. So a number of training modules we've developed and also recommendations on how to make sure workers can stay safe, healthy, but also have proper well-being in the workspace. And I think a lot of employers are moving more and more towards these models, making sure that there's things like regular breaks and being leaders and role models, and not scheduling meetings at times of lunch breaks, for example, or too late in the evening. Or making sure that workers are still communicating and having those kind of social interactions with their colleagues despite periods of extended lockdowns or extended teleworking. Social support goes hand in hand with that. We saw that many workers didn't have that social support, people that were living in isolation, older workers, or workers that were with others in the house, but maybe were suffering from things like violence and harassment. And so there was different actions that were suggested for this. Many countries created hotlines for workers that could call and discuss their issues. But also at the workplace level, there was new procedures for crisis response, for discussing matters of psychosocial health in confidentiality. So this was something that was highlighted. And one important outcome here was the importance of making sure we can maintain confidential systems for openly discussing real challenges when it comes to the lack of social support during teleworking. Another important area is psychosocial support. We just talked a little bit about that, but it also goes hand in hand with social support. This was a little bit more specific. So these are about having those proper mechanisms in place at the workplace to make sure that workers are not only socially supported, but have proper psychosocial mechanisms in place. So these are things like creating novel systems to examine stress and burnout levels and anxiety levels. How can employers do this in a confidential, open way? So this was a big challenge, but it also forced a lot of enterprises to devise new mechanisms to do this. So are they new ways to implement questionnaires and surveys, or then using those results, develop techniques, develop new classes, tutorials, apps that can manage stress reduction during the most stressful periods. So in addition to all of these 10 areas, key action areas that I've been discussing, something I want to close on, and something I've discussed throughout, is that importance of social dialogue. So the ILO was really founded on the importance of social dialogue, and sometimes this phrase can sound very big and daunting. Social dialogue, it's this tripartite mechanism of governments, workers, and employers. Yes, and we saw that that was very effective during the pandemic. We saw that when governments can speak at the national or the local levels, even to the enterprises, they can hear more clearly what are the challenges, and then workers as well can benefit from those new policies. But we also saw the importance of social dialogue at a more local, individualized, personal level. So worker-employer interactions, the importance of not having those barriers, the importance of having employers recognize the real challenges and risks to workers, and also having greater openness and transparency on what workplace satisfaction and workplace well-being really means in this new era of work. So that's something that I would like to close on. I think it's important that we continue to model those behaviors, even as we move to this now changing arena where some of us are moving back to the workplace. It's still a very important consideration as we move into an increasingly uncertain world of work for the future. So I've also named a number of resources. I'd be happy to share those with everyone that's here with us today, but we have a number. These are just a few selected ones on some of our checklists, our recommendations, our publications, very practical mechanisms, things like a safe return to work, our action points that really capture the most important areas for psychosocial risks. So I'd be happy to share all these with you and hopefully answer any questions. Thank you so much.
Thank you for that, Holsker. Very appreciative, very informative, and very revealing in terms of how much has really been learned over the last couple of years, which I don't think necessarily many stakeholders have fully appreciated. Not just the actual impact on the individual, but also on society as a whole globally. Now, Any questions or comments from any of the panelists that would like to share based on what information Hauschka's put forward? Or should I go straight into some of the questions that we've put together to share with the audience?
I think it's just an observation actually from Hauschka, and you picked up on the management aspect. Certainly during the pandemic, one of the things, and this may be a UK statement, I was really impressed on how companies came together just to help each other. So the collaborative element went through the roof, which is amazing, because I think that helps a small business owner. You know, you're looking at understanding how you help your staff, how you help your clients, but also how you keep your business running in what has been a phenomenally unusual time of trading. But actually that collaboration is one of the things that I saw in evidence very strongly right way through 2020 and into 2021, and I really hope continues going forward. And I was just wondering whether you've seen any of that as well in your research and studies.
Absolutely. So we work with one of the largest employers organizations, the International Organization for Employers, the IOE, which contains many different enterprises within it. And we saw that absolutely sharing it was kind of a survival mode, wasn't it?
Yeah,
it was trying to find the best, absolutely. And it was trying to find the best practices in those times where there are so many pressures happening. And I think that's all kinds of collaboration, whether it was that social dialogue I mentioned, but also the kind of horizontal discussions that were happening between business owners was hugely important for, at the time, not only their survival, but also their reassurance and their ability to be able to lean on each other and also coordinate those actions. You know, it's really true what we saw, this kind of leveling of the playing fields, that everyone suddenly faced the same challenges. No one was really immune to the real risks. And I think it was a huge time of cooperation and collaboration across business owners as well. Yes.
Okay.
And I think as well, in my own experiences, what I've noticed as well, there was a lot more understanding in all elements of the supply chain. True priorities came out. People became a lot more obliging in terms of what were the real business issues that need to be addressed. A lot more understanding. In the past, a lot of the supply chain had demanded everything straight away or as quickly as possible, but became much more understanding and much more flexible in terms of understanding limitations due to COVID. And I think that in many ways reinforced many working relationships. And I'm a big believer in both an individual but also organisationally building resilience. And the companies that were able to adapt, the companies that were able to work more flexibly, not just with their people, but with their supply chain as well, they're the ones who seem to have come out stronger now. And I think they're the ones who are best placed when we look to how we move forward in the future, if there is any other pandemic or any other risks that emerge similar to this one.
Yeah, absolutely. Yeah, very
so
important point, I
friends,
think.
should I head into the questions?
Yes, that would be great.
Okay, right, really. So the first question, really, which I think you've covered a lot of it, but really, how do we feel as the panelists in terms of how well do you think we've really shared lessons learned and best practices? Do you think there's a lot more to come, or do you think we're well down the road to sharing? Because my own experience, I found it's very mixed, and even now, there still seems to be a lot of inconsistencies. And personally, I don't think the governments have worked far enough together. But I'd like to be interested to see what your views are in terms of how well do you think we've shared lessons learned and best practices.
Sure, Hugh, should I answer that question? Or should we open it up a little bit? I don't know how you wanted to do this. Oh, no, I think he was frozen a little bit.
I think he's frozen on us, isn't he? I think he's frozen on us.
I
mean, certainly from our perspective, we saw lots of best practice happening, as you said, as we were just talking about this collaboration as we went through the pandemic. Have we captured that? I'm not sure that we have, and I think there's still a lot more to come because, you know, we still haven't got through all the aspects here. We still got supply chain issues, we still have resource issues, and a number of other things. So I think there's still a lot of best practice to learn and to share.
Absolutely, I would agree with that. And I think one of the fears now for many partners in the world of work is that we're moving back to a normal a little too quickly. Of course, it's a new normal, but I think there's a real challenge here because there's, of course, this huge human desire to return to some kind of normalcy. But at the same time, taking those lessons learned, because we can be vulnerable to huge shocks. And I think it's important to realize that it's not just shocks to things like novel viruses, but we're also dealing with many different changes in the world of work, things like climate change impacts, things of sudden environmental degradations and climate change disasters, and also moving to those huge shifts that I mentioned of informal economies and online work and gig work. And this is something that also puts a burden on workplaces and forces us to consider what do we do to ensure, those fundamentals, as I mentioned, workplace health, safety, well-being. And we can't be too quick to return, also knowing that we're moving in a direction and not really moving backwards or stalling. We're moving really towards a different type of future when it comes to working conditions.
Thanks for that. Much appreciated. Now, in terms of well-being and welfare, sorry, Caroline, yes?
Yeah, I was just going to add something to this. I think it goes back to culture, not geographic culture, but organizational cultures. And I think fundamentally the idea that you go back to normalcy is flawed. We evolve, we move on, we move to a different type of what we would consider normalcy. And I think the organizations, as ever, with any type of crises that adapt are the ones that are best suited to thrive going forward. And in my experience, a lot of it depends on the culture, and the cultures that accept that, organization culture that accept that things change and that there is a need to adapt and that there is a need for flexibility, are the ones that actually do really well. So I think I agree with you, Hugh, that there's a mixed bag, and the mixed bag is not new. The mixed bag almost happens with every crisis, every form of disruption. Some organizations seem to emerge really strongly because they've embraced the change and they have listened to their stakeholders internally, their employees, to make the right type of changes that fit them now. And organizations that cling to a certain form or norm from the past are going to have a lot of issues. So I think we maybe have seen it amplified because this crisis has been so impacting everyone in so many different ways around the world. But I've seen this before. I mean, after the financial crisis, in 2008, there was a lot of adjustments that need to be made, probably not enough. So I think a lot of it comes down to organization culture. And what does that depend on? Leadership teams.
And there was a good example of that over this weekend, wasn't there, Caroline? I don't know whether you saw on the news. And for those of you that aren't in the UK, we had some pretty horrific weather in the UK last week. And there was an interview with some guy on the television on Friday who was trying very hard to get into the office because his manager had mandated that he needed to be in the office. So we spent the last 2 years working quite happily away from the office, and this poor guy was being told in the middle of a terrific storm that he had to be in the office. That for me isn't great organisational culture.
Absolutely.
Yeah, and I have to say that I saw that also among quite a few organizations where, top management insisted to still be in the office wearing a suit. And then, of course, everybody else feels that if they don't do the same thing, they're not going to be visible. They're going to be ignored. So I think, yeah, the example is set by the top, I'm afraid, and that sets the tone, that sets the culture.
Mm-hmm. Yeah,
Definitely.
Yes.
And it puts undue pressure. And I think a lot of the mental health that Halsha has communicated also comes from that. I see in one of your charts with the different types of things, you have dysfunctional organization. I mean, that's not COVID specific. Dysfunctional organizations have existed, and will continue to exist, whatever the context. And they're highlighted, or they become a bigger problem in this type of context now.
absolutely. Yeah. That's a very good point, and I think so much is context specific, as you're saying about these cultural situations in different organizations. Going back to normal doesn't make sense. Of course, we're moving forward to a new future, but there are some considerations. I mean, we are right now, of course, not traveling nearly as much as we did. Actually, we're not traveling at all. But we really see that in our context of being civil servants, trying to help constituents all around the world in certain settings that don't have those virtual connections, we also see problems. And so in a way, we're not trying to move back to the old normal, but we're also saying to our managers, to our leaders, that we actually do, in certain cases, need to travel. Yes, so much can be done virtually, but we also have other constituents that haven't participated in global policy discussions on OSH because they just don't have that connectivity. They don't have also that organizational culture. And so much has to do with context. And that's something I think that we're battling with, is how do we go forward, balance the realities, bring in the new lessons learned, but also ensure that we're being loyal to our constituent needs. So that's something we're actively dealing with right now.
Yeah.
That's an excellent point. I think that brings us on to one of the strong questions. Really, as risk professionals, in terms of the future of risk and safety management, what do the panel believe that we need to do next as risk professionals to shape ourselves up for the impending changes that are inevitably going to be facing us in the future?
Helen or Caroline?
Yeah.
Go for it, Caroline.
I don't want to take all the spotlight.
Go ahead.
Well, for me, this isn't about the future. This is about the now. We need to start thinking about the now. This isn't about kicking the tin down the road. This is about considering what we need to do now. And for me, that's looking at how we take the lessons from the last 2 years and apply them to the now. It's about how we look at our supply chains. It's about how we think about hybrid working. You know, a lot of us have already been working at home, but I think one of the challenges we see in many organisations is how do we make sure that those people who are not in the office, when there are people in the office, feel they're not missing out, because that's another stress factor. If you feel that you've got to be in the office in order to be seen, then I think that's a stress that individuals we need to manage through with people. But it's also about not forgetting about the last 2 years. There's been a huge amount of really good stuff that's occurred, whether it be technological improvements, whether it be allowing people more flexible working hours, whether it be saying to them that you don't need to work between 9 and 5, you can balance your day around you. One of our clients bought all of his team, it was a relatively small business, but it bought all of his team a pair of walking shoes, gave them gift vouchers to go to a local shop so that they got out and actually did some physical exercise once a day. Brilliant idea. You know, he doesn't want them in the office all of the time. He wants them to embrace some of the great lessons that have been learned over the last 2 years and to have that balance, to spend more time with their family. And then on the flip side of that, we hear some pretty horrible stories where managers are not trusting their employees. So they want to see them in the office, or they want to watch and see what's going on with their computer screens. And that for me is a bad culture. And that goes back to your point, Caroline, around culture of the organisation and tone from the top.
I think unfortunately a lot of it comes down to it. But if we look at risk management as a whole, I think one of the challenges is that most people see risk as a negative. They see that it's abstract, it hasn't happened. The very nature of risk is that you try to identify and frame something that might happen. And because it's abstract, a lot of people have a hard time imagining what it consists of and what it might mean to them. So inevitably, risk is often in the hands of professionals who map it in such a way, using statistics, ERM, whatever system you use, and try to create some sort of framework for the organization, except very often the people in the organization really don't understand what it's about. And so is there place, and the other point I wanted to make is that the human psyche is not very good at dealing with uncertainty. We like control. Risk implies that you're trying to put some control around something that may happen. So we're not very good at framing or making a risk tangible. And I think for a lot of, and I've spoken to a lot of organizations, our clients, a lot of people who should have a role in risk, at least in taking part in it, are excluding themselves because they don't get it, or are excluded because it is in the hands of a few professionals, either in the planning or finance or safety or whatever. And I think that idea has to change. The other thing is, risk is not as we all know, risk is not necessarily negative, because if you look at risk, you actually can improve the way you do things. So it has the opportunity component, but it's not necessarily very well communicated. So if we change and if we try to map risks, how do we make people in the organization understand that this is something that is going to be in place because of what might happen and is based on history? But history alone is not enough. So I think there is something that needs to be reframed in the way we communicate risk, and we involve employees in the risk mapping and risk resilience. And I don't think we've been very good at it in general. That's my perspective.
You're right there, Conor. Yeah, and this is an opportunity, I think, because the way people have had to change their own behaviours in the workplace, they have become more engaged in risk management, be it forced due to COVID. I think it's taken us to a new plateau where we can actually change the mindset of people in terms of risk acceptance when it comes to going forward. Any our panels have any view on that?
No, I completely agree, Keith. This is about changing our psyche. It's about what we've been talking about. It's about.
Yeah. Whereas before, people, it's not my job, it's not my part. Somebody else in the organisation should be looking after that. I think people realise there should be this inherent sort of self-resilience or the self-risk management element to everything we do within the workplace now. And and not just in the workplace, within life. I think people's whole perspective has changed in terms of values and in terms of their own sort of interdependency on the management of risk in any role or in any function of life.
We have a saying in my company when we talk to clients about risk and crisis and business continuity, which is really what we do, is that risk is a pull-up phenomenon. You need to lift it from the lower levels of the organization, create a culture where reporting a risk or reporting something that is not right is actually valued and cherished, as opposed to scorned upon because you're not smart enough and you're not doing your job. Crisis management, by contrast, and crisis readiness is a push-down phenomenon. It is not a question of if. Everybody has to toe the line. This is the process, and this is how it's going to work. And I think if you believe in that, then you foster this culture that if something does not working, the staff, your employees need to feel free to say, this is not right. There's a problem here, or this is exposing us to something I'm not quite sure, but I'm not comfortable with that. And that should be valued and cherished. And I think that's the starting point. And instead, what you see very often in high levels of organizations and risk and finance department are complex ERM systems with statistics that really doesn't speak to people. So that's my take on it. So we've certainly tried to simplify it in the work that we do to try and make it more absorbable by larger people and larger groups of people in the organization.
I think that brings us on to
I'll illustrate. I was going to say I'll illustrate with perhaps one example. I actually come 30 years ago from a communications background. Until today, the number of people who are in communication, who are supposed to manage issues and stakeholders, who have never seen a risk register in their organization, boggles the mind. So whose fault is it? You tell them there's
crazy. It's absolutely crazy. You're right. Whose fault is it? It's going to start at the top, my friend. You're right. I think this brings, in terms of business in the boardroom, I think you're right. It is about us influencing. What do you really think we've learned as risk managers about how to manage C-suite members? Because ultimately, that's where it starts. That leader, that direction's got to come from the top in terms of raising people's awareness. Do you really think we've learned enough, or do you think there's still a long way for us to go in terms of re-educating our senior managers in the importance of good risk preparation and good risk understanding?
This is a good question. The question comes back, are we going to be better prepared going forward. And I think there's some stats out there that show that after every crisis, there's an uptake.
That's what I believe. Yeah.
The level of readiness, the levels of investments, the funds, the resources that are put in there. And then complacency sets in until the next one. And I think it goes back to the fact that if business is thriving, why should we talk about risk? It's negative. Why should we invest in something that we've managed until now? So I think you probably have three buckets of organizations. The ones that do it because they know it makes good business sense, and an experience like COVID is only going to reinforce it and make them invest more in it. The ones that kind of are in the middle, that will do a bit because they've always done a bit and they manage within what they can do. And the ones who kind of sail through and think, okay, well, we managed without it and we survived, so fine, why should we spend money on it? So I think it does. So I think at the board level, being able to highlight the impact is the outcome, the impact as opposed to the process is the only way, I think.
It would appear we've lost Hugh again, but just to come on in that point as well around the boardroom, we know that very sadly, or perhaps rightly, depending on which side of the table you sit, we certainly in the UK, we're expecting to see an increase in the number of claims on the directors and officers insurance, because perhaps they haven't been managing the risk correctly, whether it be from a health and safety perspective, whether it be from a shareholder expectation perspective. So unfortunately, that type of event will always drive improvements within the boardroom.
I think you're right. We need to change the shape then. Yeah.
Connection is not great. Seems we going in and out. I don't know. No, we don't hear you, Hugh, anymore.
Yes. Yes. Can you hear me now, my friends? You okay?
Now we can.
Yeah.
Oh, sorry. Right. I'll try and come back in. I do apologise. Okay. So yeah, I think you're really. I don't know what's happening to the connection. I apologise. I think you're right. It does start at the top. I think another key point that's come out of a really, really solid and really informative presentation from Hauska was the importance of how much impact this actual pandemic's actually had on people on the front line. Do you think we're doing enough, or do you think there's a lot more that we need to do to actually improve and learn lessons from how the people on the front line have been exposed? I'll share with you an experience. I was actually surprised at how many times I've seen people nowadays who seem to be less tolerant, seem to be more aggressive, whether it's shopping or wherever, in terms of, my first reaction when they actually released some of the actual rules in terms of shopping and getting out was actually to embrace the fact I could interact with people. But it seemed there's a lot of angry people out there. A lot of people seem to be less tolerant, and people like your frontline workers, for example, people in the shops, people who are delivering stuff, people working in the health service. I've got a niece who works in the health service, and she's actually she takes the calls for emergency responses, and she said sometimes the people and the attitudes of people and the rudeness and the aggressiveness of people, I think there's a lot for us to learn still. I don't know what your thoughts are in terms of how well we've prepared some of these key workers in terms of their physical and mental health, because I think there's a lot still to be learned going forward.
Yeah, that's a very good question. I think that there's been almost a global reckoning for some essential workers. We've been seeing it at the national level in many countries. Just here in Switzerland, for example, there's been many protests from the side of nurses and essential healthcare workers that are I guess it's a challenge that's been happening for many years, but now we're saying we've proven our importance to response efforts, specifically during the pandemic and beyond, and that now there's more requests being made because there's things like, what is our real social protection benefits? Why are the salaries continuing to be so low? So there's real questions of, more of an equal playing field to when it comes to protecting these essential workers from the real risks that they're facing and making sure that they're prepared for the future. It's been happening in many countries where this really reckoning of who we need and how we appreciate those people, whether it's through things like risk and safety measures, but also greater pictures of social protection, making sure that there's more respect in general for those professions, but also this ability for those workers now to really make their mark and make their place and certain demands that haven't been met in the past.
Thanks for that, Hauska. I mean, talking to some of the people I know who work in the health service, they were quite overwhelmed at first when there was the Thursday night 8 o'clock clap. Everybody be on the doorstep clapping away for a few minutes to appreciate them. And then it was quite sad because a lot of the people I spoke to said, well, you know, it really did, if anything, that triggered people to go the opposite. When it came to them responding and doing things, a lot of people turned quite aggressive and were less tolerant, which again, I think is possibly a consequence or an effect of the fact we didn't manage it or didn't necessarily get the communications right from the top. So people, I mean, I know a lot of time and effort has been put into COVID and to trying to get the vaccine rolled out and things like this, but I think a lot of the people are under a lot of unnecessary pressure, and I think sometimes people's expectations weren't as well communicated as they should have been. So in terms of looking at you mentioned about the fact, you know, about people and in their roles not getting necessarily the respect. Do you think we've really entered a new dimension when it comes to legal rights and legal issues? When it comes not just to protecting the workers in terms of their contracts and what protection, what legal rights they have, but also can you see it becoming a claim culture as a result of COVID, as a result of people feeling under too much pressure to return to work? I mean, one of my big concerns is that there's a lot of genuine people out there who've been affected by COVID in terms of their resilience. To be honest, it's impacted a lot on me recently. It really has with other factors. But I also think there's other people out there who will take the opportunity to try and abuse it. How do you see things going in terms of legalities? Anybody experienced anything there at the moment in terms of changing mindsets or changing cases when it comes to contracts or the legal expectations of employees?
I haven't seen anything yet, Hugh, other than, you know, as you know, I take part in a number of insurer forums, and as we know, they're already beginning to see increased claims on that directors and officers liability insurance, which for those that are not in the UK is an insurance policy which is aimed at senior members, senior leadership team of companies, of private companies, to make sure that they actually deliver what they should be delivering. Are we going to see some kickback on mental health and where perhaps employers have not been putting the right level of controls in place? I don't know. Certainly from a UK perspective, we do tend to live in a pretty litigious culture. I think time will unfortunately tell on that one. I do think, though, in terms of some of the, if you like, the goodness that's just happened, and I use the word goodness in a slightly, be very cautious with how I've used it. You know, that the situation that we've seen in the UK with numbers of lorry drivers has actually been a risk that the logistics industry has been suffering for many, many years. We have an ageing population when it comes to lorry drivers, and actually, like, one of the good things that's come about is it's really highlighted a problem that industry has been struggling with, and therefore we've seen additional controls being put in place. You know, the opening of additional slots for drivers. We've seen the drivers' hourly rates and wages go up, which is wrong, which is absolutely the right thing to do, rather than where they've been held previously. So it has actually accelerated some improvements for some groups of workers.
Thanks for that, Helen. I think you're right. There's been an awful lot of positives that come out of it, and we shouldn't really always dwell on the negatives. It's important we learn going forward, but I think it's right. There are a lot of positives that come out of it, and it's important that we try to consolidate these and share these. Could I ask the panelists, each of you, what do you see as the real positives that have come out of this? Because you're right. I think we shouldn't paint a negative picture on it. Yes, we have learned lessons. Yes, we weren't prepared for it. But as you said, this developed resilience for individuals and for businesses. Can any of you share what positive you feel really have made you a more complete risk manager, or really enforced you in your profession, that you'd like to share with the audience?
I mean, from my perspective, the only thing I can see is that every industry sector. So traditionally, it's the high risk industries that were always at the forefront.
Yes.
And then, you know, finance got into it, and then there's a whole historical development. When I started, it was oil and gas, nuclear, aviation, shipping, petrochemical. And then, you know, you had financial jump on the bandwagon, and then you basically had food safety as another one. And I think those industries are now very regulated, and as a result, they have to put a lot in. I think, if anything, this experience has brought it in the front of everybody. No one was spared, and so, you know, even the smaller organizations, can they carry on without completely ignoring all that? I don't think so. Even industries that are normally not, you know, not prone to high risks are the ones they suffered. And if I can make the parallel, I remember when 9/11 happened, you know, all these companies in these brokerage houses and financial service company in the Twin Towers all had contingency plans in place so they could, on Monday morning, operate from somewhere else. They had the tech. Not a single one was ready for the people loss. Not one. Because it didn't happen in the financial industry. It was the service industry. What risk can we have? And they ended up with huge lawsuits from people because they were not prepared. So I think with every one of those, you end up having sort of an expanded awareness, and that spreads across different industries. And this one, no one was spared. So the only thing you can hope for is that indeed the subject is more top of mind now, and at different levels based on the size of the organization and their exposure, some things will be put in place to be better for the future. So I think that's the positive. Unfortunately, you know, it comes out from something really negative. Something comes out that you hope, yeah, there will be more in place for everybody.
And if I look at the two, I think I would call on two key risks, two improvements we've seen, which we should not go back on. One for me is the level of innovation that we've seen in the last 2 years. What is it? They say that necessity is the mother of all invention. If we look at how we've managed to move from being, you know, very, very much Victorian workplace environment, you're going to be in the office between 9, you're going to leave at 5, you're going to commute every day. The amount of innovation that has occurred in the last 2 years has been absolutely amazing, absolutely brilliant, and we should not step back on that. And then I'd add to that as well, the ability and focus that we've had on mental health and wellbeing been massively overdue. There's again the sea change we've seen on that, the absolute step change that we've seen around mental health and wellbeing. And actually, I think the two come together very, very well in terms of how we can support individuals with their mental health and wellbeing by allowing them to spend more time with their families, allowing them to work different hours, allowing them to possibly not have such a paper-based processes that you know, that. And Tim Sismy, I know, has written a really great article in the Sentinel this month around how to make workplaces more efficient by having employees more engaged. The two go together phenomenally well. So I don't want us to step back on those, but really to embrace and to continue to drive that innovation and improvement right the way through everything that we do.
Right, and something I wanted to add at the global level, at the international level, that we've seen is really a positive, is this understanding of the importance of occupational safety and health. I mean, we've been pushing, of course, these messages for years, and as OSH professionals, it's central to our work, but we've seen that other people are seeing finally the importance of this. And as I mentioned, not only safety and health, but also that added concept of psychosocial well-being, which is certainly new for many workplaces and in many regions of the world. So much so that this summer in our International Labor Conference and also in our governing body happening in a few weeks, we will be discussing at a global level, on a global platform, the potential of integrating occupational safety and health into our fundamental principles and rights framework, which is a framework that countries are obliged to follow if they're member states of the ILO, which many countries are, most countries of the world, 187 countries. And so far, fundamental principles and rights include things like freedom from child labor, freedom from forced labor, freedom to be able to have collective bargaining, and the freedom from discrimination. So you see that OSH will hopefully be moved to some of these extremely high-level actions that so many countries will then be following, and also have implications for things like free trade agreements. So we see at the local level positive changes, but we also see this very important international policy level change and new understanding with what occupational safety and health means for the world, for safety and health, for productivity, for resilient economies, etc. So we see this big change happening also at the global level.
Thanks for sharing that. That's excellent. One of my big concerns, I'll be quite honest with you, is the fact that we, the developed world, we've led the way in terms of developing the different vaccines, making sure we get our people vaccinated, get great programs in place. Admittedly, each country's taken their own protocol there. But as you notice, the actual variants that came through came from places like South Africa. One of my big concerns is the fact that we're going to create perhaps a 2 or 3 tier system, whereas the developed world cope with it much better than the developing world and developing nations, partly because financing it. Do you see the ILO playing a big part in ensuring there's some form of unity, there's some form of consistency? Because I think if we aren't going to actually come to terms and turn it from a pandemic to an endemic, I think it's important we have a global management policy where we help those nations that are poorer, because this is where the variants are likely to develop. So it's going to be a recurring problem unless we can actually get to grips on a global scale. What's your thoughts on that one, Hauschka and panel, please?
Yes, no, absolutely. So the ILO treats all of our constituents on a completely equal footing. So the member states from all around the world have the same inputs and the same needs and the same responses from the ILO as any other country. And so that's been one of our priorities in making sure that we don't just make recommendations for things like teleworking, but we make recommendations also for those essential workers, or for a huge portion of the world's workers that are working in the informal economy, that are working in the rural economy, that don't have the same protections that we have. And so a lot of our work goes to making sure that there is that equal playing field, and making sure that all countries and all stakeholders have a voice in a resilient recovery, and that this recovery is really human-centered, and it's focused on the needs of those workers that can be the most vulnerable around the world. So yes, absolutely, it's something that's one of our highest priorities.
It looks like we've lost Hugh again. Caroline, what's your views on that?
I think everything that Hauschka said is, I totally concur with this. I don't necessarily have a particular additional comment on this point from my experience of what I've seen of my work with my clients.
Okay, looks like we've lost Hugh again, doesn't it?
This is Sue here. Yes, I think we have lost Hugh for a moment. I've got a couple of more questions I know Hugh was keen to ask. So it's really looking at things like, the infrastructure, HR, working from home. So how do we actually encourage and support our workforces to adapt to this new sort of hybrid future? Any thoughts?
For me, that's my organisation. We've very similar to Caroline. We've been working remotely for years, but for me, it's around the tone from the top, and we're a very collaborative organisation. I listen to what my employees want. This isn't about dictating. Some employees, and I think Hauschka said this right at the beginning as well, some employers want to go back to the workplace 100% of the time. Some employees would like to have a hybrid environment. For me, it's around dialogue. It's around talking to your interested parties, talking to your employees and working out what they feel is best for them. Because ultimately, if you get that buy-in from them, you're going to get the engagement with the employee as well.
Totally, I completely agree with that. I think it is perhaps harder to do for larger organizations because there's got to be a mechanism in place to accommodate a certain amount of flexibility and the individual situations that employees can find themselves in. So there's more. I mean, in smaller organizations like you, Helen, or ours, it's very easy to just talk to our people and our team. But the larger ones, you have to have a process for collecting that kind of feedback and doing something about it. And it's harder. I think it's not as easy, and shifting that culture from something that is more top down to something that is more collaborative is not new. It's just been precipitated by what we've lived. And I think at the end of the day, some organizations will probably find it too much of a hassle. And we'll hope for a majority going back to some sort of in presence, and a few will try to accommodate themselves. I see that, among friends and other colleagues working for larger organizations. It's really a mixed bag. So yeah, I don't think it's an easy one to address, to be honest. It should be, but I don't think it's easy.
Halsha, any thoughts?
Yeah, but just to echo also what Helen and Caroline mentioned, I think one of the big takeaways for us was the importance of flexibility, of being individualized. Just as Helen mentioned, there are some employees that do much better from home because of their long commute times or because of other issues, or maybe because they're facing unnecessary stresses in their actual workplace. That's also can be a case, and that they feel much safer, much more comfortable at home, or it can be vice versa. Some people are very lonely and feeling isolated in their homes and need to be in the workplace, or have different personalities, extroverts versus introverts. And so there is such a mixed bag, and therefore one policy doesn't fit all. We've seen that at the ILO too. It's something that we've been working on. We have a huge number of employees, and our policies right now are very flexible and allow for you working in the environment that makes you the happiest, the most productive, the most valuable contributor to the organization. And so I think that should be the bottom line of development of policies, is in making sure that they are respectful of the needs of workers, not only for their well-being, but again, for the productivity of the organization.
Yeah, I would add to I think the personality is very important, but it's even down to things like some people have a very easy time to be self-starters and get their work going first thing in the morning. They're very organized, and others need the collective or the group to be stimulated and to be more productive. So even down to things like this, but I even see it in crisis response and crisis management teams having to operate and manage crisis virtually or in a hybrid format. Actually, virtually, assuming you've got the right technology, and I'm not talking about Teams, but proper crisis communication tools that are resilient to all sorts of different challenges like cyber and et cetera. But if you work I've seen crisis teams operating in hybrid. That is really difficult. So some of them are in the office getting the information, whilst a few others are actually managing this virtually. So, and that's the pressure and the stress of a crisis. And I think they shouldn't, as much as possible, people should have the flexibility that if they're more comfortable coming to the crisis room, then they should, unless there's an actual physical reason why they shouldn't. So I think it's down to also flexibility to create the best output. But if in a hybrid format, if you work as a team, generating that output, I think is more challenging than virtual or in person. Yeah, I think that the hybrid is actually difficult if you have to work as a team on a task, project or crisis or whatever it is.
Yes, I think you're right. It does. It creates a lot of barriers that we don't always see. Some people feel isolated, and levels of engagement will vary in that type of environment, sadly. And I think, it's something that I think different organisations need to work at. And as you said, it's not going to work for all organisations, but some it may not. My friends, I do apologise. Connectivity has not been good for us today. Are there any closing comments, any closing remarks? Hauschka, it's been absolutely fantastic input. Thank you so much. There's a lot of food for thought there. I'll be digesting those slides in a lot of detail after this meeting. Caroline, as ever, Helen, as ever, your inputs have been totally invaluable. Thank you so much. Any closing comments or remarks you'd like to share with our audience before we sign off in a few minutes?
Stay healthy.
Yeah. It was a pleasure to really hear feedback from all three of you. Thank you so much. It's always a great opportunity to engage with others. So it was a pleasure to also hear your views, which are very unique and very practical. So thank you very much.
It was a fantastic, very insightful presentation. Thank you very, very much.
Thank you.
Really, really good. Thank you.
Okay, my friends, thank you so much. Keep safe and well, and look forward to future engagements as well. On behalf of
Thank you.
IIRSM, I'd like to thank you all for joining us. I hope you take some good lessons learned away from what we've shared in terms of discussion and the invaluable PowerPoint that Hauschka shared for us. Thank you very much, and we look forward to speaking to you all in future.
Thank
Have a
you.
safe week.
Thank you so much.
Keep well, everybody.
Thanks,
Goodbye.
Ellen. Bye-bye.
Thank you. Bye-bye, everybody.